If you've taken any of my holistic courses, you know that you learn a lot of information and a lot of techniques. So, do you ever wonder how to integrate all that you've learned with your pregnant and postpartum clients? Well, in today's episode, I talk with Dr. Rachel Elizabeth, a physical therapist and certified birth healing practitioner, about her motivation for getting certified and the impact it has had on her client sessions. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody. Welcome to this episode. And today I want to share more about my certification process to become a birth healing practitioner, a certified birth healing practitioner. And today I have with us Dr. Rachel Elizabeth. She is a physical therapist in Michigan, has her own company, and I'll let you introduce yourself a little bit more, Rachel. Tell us more
Sure.
about you and what you're doing.
Thank you so much for having me on. Yes, I am a physical therapist in Rochester Hills, Michigan, and me and my team work with ladies from fertility to postpartum. I even have some women that are in their perimenopause, menopause years, but our main focus is working with pregnant and postpartum moms. And the goal is to teach these moms skills and tools that they have in their own power to help have a better pregnancy, labor and delivery, and postpartum. But with that comes a lot of doing hands-on manual work because certainly there are people that have pain or we just want to help so baby's in a great position and so that moms feel really good in their pregnancy and their healing postpartum. Mhm.
Awesome. Well, so Rachel, we were just realizing that it's been 5 years since you've taken your first course with me, correct? What
Yeah.
what was the impetus to come study with me?
So I have always just had a passion since, yeah, I have like 5 kids. And my first baby, I didn't know like anything about labor and delivery, pregnant. You just do whatever your providers kind of tell you what to do. And over the years, I started to have bringing in more holistic approaches to labor and delivery and worked with the midwifery team and seeing their approach by doing like hip squeezes and different things that I saw in like kind of a general like PT ortho practice and how it helped really inspired me to be like, why are physical therapists not working with pregnant people? Because I never heard of it. Like you get your occasional like pregnant lady that came in with like ab separation and she didn't want to have it. So what can we do? Right.
Or back
Um,
pain, right? That's a
or
common.
back pain.
Yeah,
Yeah,
right.
just like just very, but very, I would say when I did I had my first job before my own business, I think I saw one pregnant lady, like
Mhm.
out of hundreds of people. So I really wanted to be able to offer something for moms that was missing from what I had. And looking at everything that you offered, and I'm like trying to rack my brain on like how did I actually come across your information? I don't remember. Maybe that'll come to me later.
Yeah. Was
But
it the summit? Was it a summit?
it's possible it was a
Yeah.
summit. I am a health and nutrition coach through the integrative. No, that's you.
No,
Through
Integrative
Jessica
Women's
Jarman's
Health
program.
Program?
Yeah, yeah,
Yes,
that's what I was saying. Right, I
yeah,
get them mixed up because one's institute, one's integrative, and
right.
it could have been through there, through Jessica Drummond, because I've met a lot of amazing people through there. And I just saw that you had a passion for this, and it was like everything that I wanted to have under my tool belt. And as you know, there's a lot lacking in this field. Like I think like more is coming on, but like you coming out of physical therapy school, you're not learning what to do with like pregnant clients or even postpartum clients. You're just more this like generalized view. You're not getting any pelvic floor health education at all. It's all postdoctorate now. So I really was drawn to that and a lot of the like different things you were seeing like common birthing pattern and the fact that you had so many like years of experience in bringing a very holistic approach from different avenues to women, I was like, I need that in my life.
Yeah, and we had so much fun. You came down to Florida for the, class with Kathleen Vigo in Fort
Mhm.
Lauderdale, and it was such a great, great class. I still remember that class to this day.
So
Um,
much fun.
Yeah. So what did you notice after coming and taking a course or two with me and what you found in the clinic with your
Yeah.
clients afterwards?
So even at your class, I'll never forget like learning like and excuse me if I say it wrong, but like the uterine release, like your internal, and you're looking at the cervix and you're
Yeah.
moving it around and looking to where it's at. And one of my first clients, her cervix was like out on the left side of her pelvic floor and was able to mobilize that. And like a few minutes after class, or when we were done with that, she was like, I never knew I could feel so good. I didn't know that I needed that. And then a couple weeks later, she actually text messaged me and said, I still feel really great. And I was like, wow, like that is, even if I took away one thing, like that was like the most amazing technique to learn this visceral therapy internally. And so I brought it back to my clinic, and ladies were like getting better sometimes within one visit. It was like super quick how like you could just do a few things, and you have your skill set right as a
Yeah.
PT, which helps flood into that. But just to be able to do some of the most gentle techniques, and what's missing I think too is like that visceral fascial piece that then can impact the way the bones are moving too, or what came first. So like even when you're trying to do some of these muscle energy techniques or different techniques that and you're not successful at it,
Mhm.
learning that you can then go to the viscera, to the fascia, and work through those. And then, you come back and that pelvis is like melting in your hands like butter. So it's like,
Yeah.
it was just, I was sold. I mean, the reviews that I got, the people that were like my cheerleaders were like, I was better after, going to other PTs or even just having this for a long time. And then she saw me one time and it was worth like Beth, I think
Oh,
she
yeah.
was like
Yeah.
she's my partner in like the advanced class, and even just in the advanced class like working together, she's just like, wow, this is just worth like getting together and working on things together. So
Yeah. Yeah. It's so fun, isn't it?
oh yeah, it's just fun. It's so nice to know somebody's sitting in your chair, and sometimes you're like, okay, because everybody has so many different stories. To know, okay, I just put you out and see what the body tells me. Like you don't have to like be concerned about like, I'm not really. This is kind of a unique situation where you're, not sure. You just put your hands in the body, and it kind of tells you what to do. And I think you do start to have this like intuitive sense. Like sometimes people will be like, I'll feel something like on the pubic bone and they're like, oh, yeah, that kind of hurts me. Or I'll be like, how does that feel for you? Because I am
Yeah.
definitely feeling this side is a little. And they're like, yeah, you're right. It definitely feels that way. Or I try to let them tell me before I lead them. So it's like,
Yeah.
not me leading them into it. But yeah, that's
Empowers
great.
them, right? Keep them
Yes, for sure.
empowered.
Uh-huh.
Yeah. Oh, that's great. I just absolutely love hearing from students like you that are just like, oh, this is bringing back the fun and the joy
Yeah.
in my treatment sessions. And like I was getting burnt out. And I think it's really hard for us as therapists when our clients are not getting better.
Yeah. And especially this population is so unique, right? There's so
Yeah.
many variables. You have a baby that's moving. How big is the baby? How's the mom's torso length? Like, what is her lifestyle? Like, to know that you can just put your hands on them and cause so much relief in an hour, 45 minutes, however long your session is amazing.
Yeah,
Mhm.
so cool. So what made you decide to become certified?
Yeah, so I think like right from the start, I was like, I want something like this under my tool belt. So, there's so many little, certifications you can get out there. And because of what I saw and how impactful this was, I was like, I need to keep learning. And I was like, I was so excited for the pregnancy class because of course I took postpartum first. And then I was like, I'm such a pregnancy nerd. I love helping moms with labor delivery. I want them to like feel as great as they can feel, and then even if they're not having something, it's amazing how you can do body work to help, like I said, help baby in a better position. So then that was just like the natural course to like want to go into doing it the advanced class and learning that much more. So
Yeah,
it's
yeah.
been it was just like
How
my goal for many years. And it took me a little bit of time because I
yeah,
had, wanted to practice and make sure I got it down, but I could have certainly gone right through it probably because
yeah.
I mean the way you teach and your style, and I mean I even like have my little thing that I put
Ah,
together here, right? Like it's so beautiful, the colors and like how well it's put together. Like, yeah, you can tell that you definitely poured your heart and soul into what you do in your passion, but also in your approach to like your lecture and your handouts. 'Cause sometimes you'll go to classes and like it's like a bullet point. It's maybe like all it's just like information where you're like, I can't practically use this. And I felt like it was very practical and very helpful for me. So I literally my first year of course and then after pregnancy had these manuals in my clinic, and sometimes between clients I'm just reviewing them again and like really trying to hammer in that information. So
Awesome. What did you find becoming certified did for you as a practitioner?
yeah, I think it made me extremely confident in not
Excellent.
in like I'm not trying to be like cocky or anything like that, if that's
Uh,
okay to say.
Yeah,
Um,
no,
but
it's
like
great.
I think it made me confident in my skills a lot more. There were like bits and pieces of stuff that I knew and took from other places, but it was a way that it wrapped everything up into this nice little package. Even though you can, certainly it's individualized and you're gonna, go one way or the other. It's still kind of wrapped it into like this package of like, oh, I know I can do this. So if I feel that this pubic bone is doing this and I need to check like the ilium, the ischion, and the sacrum, and then maybe the sacrotuberous ligament. Like there's almost like a pattern. And I think as I've learned this, I've also learned, oh, when I do this, if this isn't going on, I know I need to go to here. And then if that doesn't happen, then I know I need to go to here. And okay, the bones aren't releasing, I'm going to go and do fascial work and visceral work and just do some breath work with them and then come back. And now they're moving better. So I think that is probably my biggest takeaway from it is it gave me more confidence as a provider in a way that I just felt good treating my clients and not kind of worried about what am I going to do with this really unique case, you
Yeah.
know?
I've
Mhm.
heard that a lot from my certified students that it just helped them to kind of wrap their head around the material better
Yeah.
and have a deeper understanding or being able to apply it
Yeah.
more successfully. So,
And
yeah.
it's beautiful too because it's not just an external like class. Like if you're a pelvic floor PT or OT or a practitioner, like a midwife or somebody who does, checks internally, it just added more layers to doing a pelvic floor exam than a simple like let's check, how's the tissue feel, check your strength, check you for prolapse. Well, now I can actually like as I'm assessing people, I'm actually treating them. I'm checking the urethra and the bladder and the cervix and seeing their alignment, and seeing how that changes the muscle tension and just releasing the deep pelvic floor layer and not even having to touch the cervix yet, because just releasing those muscles, now the cervix in a better position. Just so many little nuances that
Yeah.
wrap it up all together, and it's awesome. So
Isn't it it again, it's like magic almost? The
yeah,
way the tissues just respond so beautifully to that visceral work, that fascial work in there, and then the muscles just kinda, like, melt, and
yeah.
there's less to do then, and it just
That's
yeah.
the beauty of hands-on work in a
Mhm.
confident way, and as a provider, just learning that intuitiveness and really being able to hone in on that. And, I've since hired physical therapists for my practice, and I recommend this class, to them. And even the feedback from my more recent hire was, wow. And like she like wanted me to review like the psoas release, and I did, and she went back and worked on it with a client, and she's like, that worked so amazingly and I'm so glad I learned that. So there's just
Neat.
little nuances too that I don't think are hard. I don't feel like it's like difficult, like certainly like learning this where I'm at, I've been doing this now for 5 years, and you kind of learn patterns and you jump
Yep.
around, you're really quick, as opposed to like, okay, let me try the book again.
Yeah.
But like it's not that difficult to
Yeah.
grasp it. So
Yeah,
it's wonderful.
one of my goals in teaching is really to get people out of their head and into their hands. And be able to feel what's going on in the body and with the tissues. So,
And then more advanced class, I would say too, since I have that health coaching background, there was a lot of like health coaching stuff kind of almost repeated in that. So
mm,
that was kind of fascinating to see that like mindful listening and reflection. And then you're having these conversations with your clients as you're doing work and you're feeling the tissues release just from some of that mindfulness piece.
right, yeah, the tissue in the body can't lie.
No,
And when we learn to work with that, it's a beautiful way of helping someone get to the really deep root cause of what's going on in those tissues. And I just I want everybody listening in to realize that all pain is not physical.
right.
That there are emotional pain, there's, trauma that can cause pain. There's just so much more that can
Mm,
be stuck in there. Just an energetic stuckness can cause pain.
right.
And and when we address it from that level, it just everything the pain just melts away, doesn't it?
Oh yeah, it's just really interesting. It's a cool feeling to feel
Yeah.
somebody who's going from like having all this tension or even reporting it. Like I think my case study was on a client who was having like elbow pain and lots of stuff going on in her life. And certainly I was doing a lot of the birth healing stuff and we were working through some of those stuck things emotionally. And her elbow pain was gone after the session. I never touched her elbows. Like it was gone and it didn't come back. So that was like, wow, that's pretty cool to, because I don't want to work on the elbow. The elbow is a really tricky joint. So, if I can just do this stuff, then we're good.
Yes, right? Oh, it's so much more fun, so much
Yeah.
more fun, yeah. Than having to reach back into our brain and remember all the joint mechanics of the elbow and treat it from that
Right.
mechanical. Now,
Exactly.
we do, being physical therapists and occupational therapists and body workers, we do understand and use that knowledge, but when it's not physical, to be able to have the skills to go there and to work with someone, it truly is magical. Like that pain just goes away. So,
Exactly. Yeah.
so cool. Rachel, what would you say to those listening in that are like, I'm kind of on the fence
Yeah.
about becoming certified?
Uh-huh.
What would your advice be to them?
I would say that at least try one of the classes and dig down deep into what you feel is serving you, what will serve you the best. Because as a business owner, like when I'm looking at classes, I am looking at, am I taking this class because it's going to serve me and my clients well, or am I just taking it to get continuing ed? And if you're finding that this is a passion of yours and you really love it, and maybe like maybe postpartum you feel really good in, but maybe pregnancy you're a little unsure, then that might be like your first step to want to do. And I think just coming in, experiencing it, you'll be sold. I mean, I just love just talking with Lynn. I mean, I remember like coming to your class because I think, especially when you're like newer, and I mean, I wasn't too new, but I just knew enough. Like when I would go to classes, it was like you're a little intimidated by the people teaching. And you just like had this way. I was like, oh my goodness, like within 30 seconds, I was like, she's so nice and so kind and so knowledgeable. But you didn't get that like feeling of like superiority. Like you felt like you were really working with somebody who was at your level and very passionate to help you become the best you can for your clients. So I always think it's beautiful when you can learn from somebody who's a master and they can teach you these skills. And I'm getting emotional for some reason. Anyways, they can well, sorry, they can teach you these skills and how it has that like ripple effect into other people that are like in your life. I'm so sorry.
That's making me emotional.
But like you have this ripple effect. So like Lynn, you teaching me 5 years ago how to help people has helped hundreds, if not more, people over the years. And that's beautiful. And I think that you're a huge reason why I am successful. And I think you need to know that. So when you say people on the fence, consider the impact that that has had on my life and those of my clients and give it a try, because I think you'll really see how this is different than some of the other stuff that you're used to typically taking. So sorry about that.
No, don't apologize. That like Rachel, that you just explained my dream, my vision
Mhm.
with this work. It's like I had a decision to make back when I started teaching this coursework because I was like, well, I could put all my effort and energy into developing a physical, institute for birth healing and brick and mortar
Right.
clinic practice. And I'm
Mhm.
like, no, I'm gonna have a greater ripple effect if I can train other, therapists to do this work and to get out there and then all the moms that they can help and support. And so thank you. That brought me to
You're
tears too because it's
welcome.
that's my dream.
Yeah,
And
and
I just
and
want
you've done a wonderful job at
aw,
it. Mm.
thank you.
Sorry.
Yeah, I know, I gotta take off this mascara.
At least you're being real here. The
Uh,
emotional piece.
And I think that's what
Mm.
you know about me as a teacher. I'm a very real person and I'd love to bring my heart and soul to this work. And I'm very passionate about it. And I really, truly just want more certified birth healing specialists all over the world. Like I'm not
Yeah,
done teaching until till I die,
right.
guys. So
And we need them. I mean, it's not we can't just be the only ones. There's so many people that we can impact. So, yeah, I
yeah,
hope more ladies do that. And hopefully in my practice, like we'll continue to get some birth healing, certifications and get my PTs doing some more of your work as well. So, yeah.
awesome. Well, thank you so much. I appreciate you taking the time and sharing your experience with us. And
Mhm.
so basically, you would encourage people to do the certification because it really
Yes.
helps to integrate everything and put it all together so that you just have a greater understanding of how to implement everything that you learn in the courses.
Yeah, no, definitely. I definitely would say this is a great way to, even if you're just getting started in pregnancy and postpartum, because that's like your passion, this is a wonderful place to start. And I would not change it. Like I wish that I had you from the very beginning because it would have been like so much different as
Yeah,
opposed to like let me put my hands on this and see what's going on here and doing this and then what do I do, like I just know now, and it becomes intuitive in your hands. God has definitely blessed me with a gift of healing, and like you have really helped kind of bring out this gift that I was given in a way that I can help others. So I'm still not trying to suck up or anything either. Like I literally do feel this way, and I that's why I encourage the team members that I have to take your classes. So, yeah.
oh, thank you, Rachel, so much. I'm
I love
just
talking to you.
sorry, everybody, for getting so sappy on you, but that's us. That's me. And I'm
Right.
so passionate and so grateful to
Mhm.
everybody who comes and takes a course with me and learns this material and puts it out into the world because I know that we're really helping moms to feel better in their bodies, to have
Mhm.
smoother births, faster recoveries. That's what this is all about.
And
So
just change and offer something that you and I probably didn't have when we had our babies. Because I have a 22-year-old. So even just like how life was for our mothers and our grandmothers didn't have this. And now we can offer ladies something that's new and that works. So,
yeah. And we
yeah.
can still help those older people too.
Oh yeah, of course. 100%. Yeah, bring them in too. Like, hey,
Right?
we weren't
Yeah.
there then, but we can help you now.
Yes. Well, I love that that's changing, and it's amazing to see the growing awareness of this work. And so thank you for being a part of that.
You're
Thank you
welcome.
for trusting your knowledge, your learning with me, and for going the distance and becoming certified with me, Rachel, because I'm so grateful for the beautiful work that you're putting out into the world. So thank
Thank
you.
you. I appreciate you.
I appreciate you too. Ditto. It's back at ya. All right. Well, thank you everybody for listening in. If you're interested in learning more about certification, please check the show notes. The links will be in there. It's also on my website. You can check us out, instituteforbirthhealing.com/certification is the page. And I believe, don't quote me on that, check the show notes. And I thank you so much for listening, everybody. We'll see you on the next episode. Take care. Thanks, Rachel.
Yeah,
Bye.
thank you.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.